Proper seating and positioning in a wheelchair should promote function, prevent deformity, improve body alignment, prevent tissue damage, and prevent additional complications for your patient. To begin measuring for proper fit, have your patient sit with their trunk erect on a firm surface wearing clothes that they would normally wear. If they will require a seat cushion or backrest for their wheelchair, have it in place for the measurements. An accurate measuring tool should be used, such as a tape measure. First measurement is from the patient's heel to the popliteal fold, and you'll add 2 inches to this number. This ensures the clearance of the footrest when moving around with the wheelchair. Then measure from the posterior buttock to the popliteal fold along the lateral thigh. Subtract 2 inches from that number so the front edge of the seat ends before the space. Then pick the widest aspect of the patient's buttocks, hips, or thighs and add 1.5 inches for clearance from the side panel. Have your patient then flex their shoulders to 90 degrees and measure from the seat of the chair to their axilla. You'll want to subtract 4 inches from this number so that the back of the chair ends below the inferior angle of the scapula. Lastly, have the patient flex their elbows to 90 degrees and measure from the seat of the chair to the olecranon process and add 1 inch. This is for the armrest height. Hi.
Hi.
My name's Jessica. I'm going to be your physical therapist today.
Hi, nice to meet you.
Can I just confirm your name and date of birth, please?
Yeah, Amanda Sturzbach, 5/25/95.
So today we're going to confirm the fit of your wheelchair that we measured the other day.
Okay.
So we'll just start with getting in this. Okay, so each time you get in and out, you want to make sure the brakes are locked here. So to pull it out, you go that way, and to lock them, you bring it towards you.
Okay.
And we want to keep these out too so you don't trip over them and fall. So once you're sitting, we'll pull it back in and lift up that leg. There you go. Same with this side. Pull it back in. And if you need, when you go to get out of it, you just pull this notch right here. Unlocks it and pulls it back out. Okay? So now confirm your fit. We want to first look at the footrest. Make sure they're at least 2 inches above the ground. We have clearance there. And then we'll take 2 to 3 finger widths to go between your popliteal fold and the edge of the chair. Make sure there's space there because this could create a pressure point that we don't want. Then we move over here to the thighs and the greater trochanter. Make sure you can get 4 finger rests between each side and the armrest. And then we'll come off to the side here. Make sure there's a triangle being formed here between the humerus, your armrest, and the back of the chair to make sure the armrests are at the proper height. We also want to be able to stick 4 more fingers between your axilla and the back of the chair there. So we're clear on both sides. And lastly, we want to look back here at her scapula and make sure we can get 1 finger between the inferior angle of her scapula and the back of the chair. If you need to raise these up or down, you lift this up towards you. And lift it up or lift it down. Do you have any questions?
I don't think so.
Okay, great.
Thanks.